Hi everyone, I'm Rosemary Barton here in Ottawa. Thanks for joining us on CBC News Network, streaming on our app or CBC.ca right around the world. We're standing by for the Prime Minister's pandemic update, expected to start in just moments from outside his home. He's expected to talk about that announcement you heard about perhaps last hour, and that is a new plan to support seniors. It's something that many of you have been asking about over the course of the last number of weeks. And just to give you some of the highlights, it will be a one-time tax-free payment for Canadians who receive OAS, Old Age Security, the public pension top-up. So you'll get one-time $300 tax-free. If you are on GIS, the Guaranteed Income Support, you will get an additional $200, so a total of $500 tax-free in a one-time payment. There are 6.7 million seniors who use OAS, who are eligible for OAS in this country. So that's a big amount, a lot of you out there, and the whole package costs $2.5 billion. Again, this was something that a lot of you had been asking about, and the government had promised an announcement in the coming days, and here we are. I'll bring in my colleagues, knowing that I may have to cut them off very quickly. The host of Power and Politics, Vashi Kapellas, and David Cochran join me, both here in Ottawa, of course. So I know a lot of people, I'm sure you all got the emails and tweets the way I did. A lot of people were very desperate for something because there have been, for seniors, some additional costs, whether it be, getting things delivered or groceries are a little more expensive, those kinds of things. So this will come as a relief to a lot of people. And then there will, of course, be questions about whether it's enough and whether there should be more, as there always are with these kinds of things. It didn't sound like it was out of the realm of possibility that there couldn't be more, Vashi, but for now, it is a one-time payment.
Yeah, for now, it certainly is just the one-time payment. And I think you're right. The big question, at least that I'm hearing so far, is whether or not this is enough. It was interesting to hear the Minister for Seniors, Deb Schultz, sort of show us exactly what they came up with that number based on. And it's exactly what you laid out, Rosie. So, for example, you can't take public transit anymore. You have to rely on taxis. That's going to cost more. You have to get your groceries delivered. That's an increased cost as well. Increase in dispensing fees for pharmaceuticals, that kind of thing. Mm-hmm. So it's those smaller incremental costs that the government has decided this is what that money is going to address. But that doesn't mean that there aren't additional needs for seniors, and particularly additional asks of the government, driven largely by opposition parties and, of course, obviously groups that represent seniors. And chief among them is, if you need to use some of your retirement savings in order to buy you some time to get through this pandemic, or you need to access them, is there a way the government can reduce the amount you're taxed for that?
Okay, we'll talk more about that after we hear from the Prime Minister. Here he is. Thanks, Vashi.
Announced a new contribution to support the Vaccine Alliance, Gavi, and the Global Initiative for the Eradication of Polio. These organizations distribute vaccines to the most vulnerable around the world and save millions of lives. More recently, Gavi has been helping developing countries to respond to outbreaks of disease such as COVID-19. Once we have found a vaccine, Gavi will be helping to distribute it to those who need it. This is good news because in our interconnected world, in order to end the pandemic in Canada, we must defeat the virus everywhere.
I want to note that earlier this morning, Minister Gould announced a significant contribution to the Vaccine Initiative, Gavi, the Vaccine Alliance, Gavi, and the Global Polio Eradication Initiative. These organizations deliver vaccines to some of the world's most vulnerable, saving millions of lives. Most recently, Gavi is also helping developing countries build capacity to respond to disease outbreaks like COVID-19. Once a COVID-19 vaccine is available, Gavi will help get it to the people who need it. And that will keep us all safer. Because in our interconnected world, to end this pandemic for good in Canada, we have to end it everywhere. Comme on le sait trop bien.
As we know only too well, the last few weeks have been particularly tough for our seniors and their families. Our parents and our grandparents are more at risk of catching COVID-19 and of suffering the most serious consequences. Right across the country, the long-term care homes and seniors' homes have been the most hard hit by the pandemic, exposing the failures of a system that must be strengthened. But the challenges of the pandemic for seniors are not just limited to what's happening in seniors' homes. The lockdown is weighing heavily on seniors right across the country. They spend a lot of time alone and separated from their families. And because they're supposed to not go out as much as possible, they can't use public transit. They rely on delivery services to do their errands, and often that means they can't take advantage of sales in stores. It's hard on their morale as well as on their finances. So today, our government is announcing new measures to help our seniors get through this crisis. First of all, if you receive old age security, you will be receiving $300 more to help you with the costs that you've had to incur as a result of COVID-19. Right across the country, we're talking about almost 7 million people who will be receiving more money in the coming weeks. And to help those seniors who are most vulnerable, we will also be providing an additional $200 to all of those who are eligible for the Guaranteed Income Supplement. That means that if you are receiving both OAS and the GIS, you will receive $500 more. Our government will also be granting $20 million more to the New Horizons for Seniors program. We did make changes to that program several weeks ago to allow organizations to adjust their services based on the realities of the pandemic and help seniors remain in contact with their families. So we are again investing in that program to provide for more activities that will counter the isolation of seniors and improve their quality of life.
Announcing new measures to support seniors during this pandemic. First, if you're receiving old age security, you will get an additional $300 to offset some of the extra costs you've had to cover because of the virus. This means that across the country, almost 7 million seniors will get help that they need. And to better support the most vulnerable seniors, we will also give an extra $200 to people who are eligible for the Guaranteed Income Supplement. So if you're receiving both OAS and GIS, you will get an additional $500 in total to help you. Our government is also investing an additional $20 million in the New Horizons for Seniors program. A few weeks ago, we boosted funding so that organizations could provide delivery services and help seniors stay in touch with family during the pandemic. So we're making another investment today to create more programs to help isolated seniors and improve their quality of life. Now, there's no question that COVID-19 has been taking its toll on seniors both emotionally and financially. And with today's announcement, our government is taking action to alleviate some of the stress they may be feeling. But there's a lot more work to be done, not only to find short-term fixes, but long-term solutions. COVID-19 has exposed some uncomfortable truths about our society, including how we care for seniors in Canada. We've seen heartbreaking tragedies in long-term care facilities and nursing homes right across the country. Overworked staff, understaffed residences, grieving families. There are serious underlying challenges facing these facilities, and in the coming months, the federal government will be there to help the provinces find lasting solutions.
Since this crisis began, we have witnessed heartbreaking scenes in long-term care facilities and seniors' residences across the country. Overwhelmed caregivers, overcrowded residences, and families in mourning. These facilities are facing significant challenges, and in the coming months, the federal government will be there to help the provinces address those challenges.
No matter where they live or what they do, has a role to play in supporting our seniors during this pandemic. It starts with following public health recommendations. You know the drill: staying home, washing our hands, and keeping a safe distance from others when we go out. That's how we can protect the physical health of our parents and grandparents during this pandemic, But let's not forget about their mental health. A lot of people, especially single seniors, are feeling really lonely right now. So call your grandparents. Ask them how their day is going, how they're doing, and how you can help. Consider writing a letter or a postcard to isolated seniors, or volunteer with a local organization to fight the isolation of seniors. We need to be there for those who have built this country for the rest of us, and that's what Canadians will continue to do. And together, we will get through this. Merci.
Thank you, Prime Minister. We'll now go to the phone for questions. One question and one follow-up. Over to you, operator.
Thank you. Merci. First question, Raymond Fillon, TVA. À vous.
Good morning, Prime Minister. With respect to support for seniors, the amounts you are announcing today do not reflect what some groups were asking for. Some people were asking for monthly increases. Is this something that you could do? Similar to what you've done for students. Well, from the beginning of this pandemic, we've known that seniors are the most vulnerable to the impact of COVID-19. And that's why we brought in so many measures as a society to try and protect our parents and grandparents by staying home and by preventing the spread of COVID-19 right across the country. At the same time, we took concrete measures through United Way, through a GST tax credit that helped a lot of seniors. And today we're moving forward again to help these seniors who are feeling a lot of anxiety and having to incur extra costs. But of course, from the very beginning, we have been focused on the people who have lost their income, such as workers who lost their jobs or students who will not have a summer job this year and be unable to pay their tuition next year. But as you can see, we will be there for everyone, all members of society who need our help, to help them get through this crisis. That's what Canadians do. We help each other, and that continues today.
From the very beginning, we recognized that seniors are particularly vulnerable to COVID-19 as a disease. That's why in our exhortations to make sure that everyone stayed home, we often talked about the need to protect our parents and grandparents by slowing the spread of the virus, by keeping people safe. At the same time, we did move forward on direct measures to support most vulnerable seniors through organizations like the United Way, and the GST return that was increased is going to help significantly a large number of seniors. But today, we're announcing more help because we recognize that every week seniors are out of pocket a little bit more for costs of filling medication prescriptions more frequently, or delivery costs for groceries, or other things that they're challenged with, which is why we're stepping up on sending seniors the help they need.
Follow up? With respect to the long-term care facilities, Mr. Singh was saying that private homes should be nationalized. Is this something you're considering? What do you see as a solution for the tragedy we're seeing now in seniors' homes? Simply transferring money to the provinces, or do you feel you should play a more active role as the federal government? Well, first of all, it's not up to the federal government to provide a solution with respect to these long-term care facilities. This falls within provincial jurisdiction. At the same time, we will be there to help and to support the provinces in looking at the various options. I think Canadians right across this country are asking just how we should be looking after our elderly, and in the coming months and years, there have to be improvements. But it will be up to the provinces to determine what needs to be done, and the federal government will be there to support the provinces in terms of the assistance they need and the changes they wish to make.
Thank you. Merci. Next question, Lee Berthium, the Canadian Press. Line open.
Yes, Prime Minister. Thanks for talking to us today. The Deputy Prime Minister suggested yesterday that traffic between the U.S. and Canada is bound to increase as states and provinces reopen. What specifically is the government planning to do to deal with an increase in inbound traffic from the U.S., considering the risk of infection?
We're going to continue to be very careful about vectors of infection into Canada. That means continuing with restrictions on international travel. At the same time, we have brought in measures that means anyone coming into Canada, returning residents, particularly, will need to self-isolate for 2 weeks. We are looking at stronger measures to make sure that we're following up appropriately on people come over, because as we know, as economic activity starts to ramp up, as restrictions get loosened across countries, it is likely that we see a few more people either returning home or a few more people trying to cross the border. We need to make sure that the measures that we're bringing forward are going to keep Canadians safe.
Follow up, please.
And given the recovery challenges that lie ahead, is now the time to ensure that all Canadians, especially non-salaried workers, have access to affordable childcare?
I think one of the things that we've seen, particularly when many of the very first jobs lost during this crisis were ones held by women, disproportionately held by women. The need for childcare has never been made clearer. That's why we will continue to work with provinces and municipalities on ensuring that there are affordable childcare spaces across the country. As a government, over the past 5 years, we've made significant investments in childcare, and we will continue to do that. It is a responsibility that we share with the provinces, and we will continue to work with them to ensure that they are able to deliver the kind of childcare that is needed for our society. Okay. Nous reconnaissons à quel point les centres de petite enfance et les garderies sont essentiels pour
daycare centers are absolutely essential for people to be able to work. And the fact is that from the beginning of this crisis, many people have lost their jobs. And of course, when we're going to want to reopen the economy, we will have to ensure that there are enough spaces in childcare centers. Now, from the beginning of our first mandate 5 years ago, we were there helping the provinces to provide daycare services, and we will continue to be there and discuss this with the provinces to ensure that we have a better daycare system right across the country.
Prochaine question, operator.
Thank you. Merci. Next question, Bill Curry, the Globe and Mail. Line open.
Good morning, Prime Minister. Your announcement yesterday, your government's big business loan program will require companies to produce reports on how their actions contribute to national climate change goals. The initial reaction from oil and the gas sector was that most large energy companies are already producing reports like this. So is this just a matter of asking companies to maintain their existing level of climate reporting, or are you asking them to do something beyond that? And if so, what would that look like?
Yeah, as you pointed out, there are many companies in the energy sector that are already taking seriously the need to plan for the longer term, to plan for reducing emissions and fighting climate change, but not all of them. And that's why we needed to make sure that as we move forward on support for large companies large employers across all sectors, that they are also in all sectors, not just in the energy sector, thinking about the challenges that climate change will pose to their company and to their future, and have a response for it.
And again, on the loan program, it's clear that large companies that have been convicted of tax evasion don't qualify. But yesterday in your comments, you went further and you said that the government will watch for, quote, aggressive tax avoidance. So what does that mean in practice? Will this rule out companies that use offshore tax havens?
I think Canadians expect that if we're going to be putting taxpayer dollars, public money, towards supporting these companies, that they be paying their fair share of taxes. We recognize that companies have often very complex ways of managing and structuring their revenue and their portfolios. But if they want to apply for the large enterprise emergency financing facility, they are going to have to demonstrate a level of transparency that shows how they organize their structures, so we can make determinations around whether they are indeed paying their fair share of taxes before we put in Canadian money. Okay.
We recognize that many large corporations have different structures in order to minimize the taxes they have to pay, but Canadians do expect that people who are receiving public money should pay their fair share of taxes. So we are demanding a certain amount of openness and transparency from those companies so that they can show us they've paid their fair share of taxes and are not using certain means to try and avoid paying their fair share of taxes. We want to ensure that if they're receiving public money, they are and have been making a proper contribution through taxes.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci beaucoup. Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. You announced a succession of different types of financial assistance for workers, for families, and an improvement to the CCB. There was support for students. Today, it's seniors. Now, how do you explain the fact that seniors have come at the very end of this long list of measures you brought in? No, quite the contrary. We always recognized that seniors were the most vulnerable to COVID-19 because of their health status and their age. And that's why, right from the beginning, we brought in measures to protect them by encouraging people to stay home, not to go and see their grandparents, by helping them through organizations such as the United Way, or giving them more money through a GST tax credit. And we have been there to support seniors. But at the same time, today, we are going even further in supporting them. We will be sending a $300 check to almost 7 million seniors across the country, with a $200 bonus for all of those who are also receiving the guaranteed income supplement, because they are the most vulnerable Canadians. We have to support all sectors of the economy, and we recognized right from the beginning that people who had lost their income or lost their paychecks, or students that would not have a summer job starting in May, needed help, immediate help from the government. But now we're very pleased to be able to help seniors who are incurring additional expenses, and this will help. Follow-up? Yes, on another subject, with respect to the border between Canada and the U.S., we assume that there are discussions about reopening the border and renegotiating the agreement that goes to May 21st. But in that area, my question remains, will you or will you not reopen the border on May 21st? Well, as you've seen from the very beginning, our discussions with the United States are extremely important in terms of ensuring that restrictions are in place, but also for ensuring that essential goods and services can continue to cross the borders in these difficult times of COVID-19. And that's why we're in constant discussion with the United States on issues such as the border and other shared issues. And I can tell you that those conversations are always very positive and constructive. Christian Noël, Radio-Canada. Seniors are among the most vulnerable people, and they're facing increased costs that they can't necessarily pay. And yet, you're only giving them a one-time payment, a maximum of $500, and some will be receiving less. Why do you think that $500 in your heart, is that enough for our seniors? Well, we know that there are many people out there who have lost their source of income as a result of this pandemic. They've lost their paycheck. Students will not have their summer job. Workers will not be able to make any money that they were relying on in order to pay for their groceries or pay their rent. Seniors are not generally in a situation where they have lost their income, but they are facing additional costs, including additional stress and anxiety because of their health status and their vulnerability to COVID-19. And that's why why we recognize that giving them additional help will make a big difference. We're giving $300 to all seniors who qualify for OAS and $200 more for people receiving GIS. But put yourself in the place of a senior who's going to be receiving $500. If that lasts a year, that means $41 a month or $10 more a week. What do you want them to do with so little money? Well, we know that this is an unprecedented situation, and we are taking action now and for the months to come. Obviously, if the situation continues for 6 months or a year, we will have to introduce new measures and have additional reflection on how we're going to support seniors, young people, businesses, workers. The help that we're providing now is short-term help for the emergency we are facing. But as you've seen, as we move forward, we will always be adjusting our action whenever necessary to ensure that people receive the help they need.
One of the things we've seen in this unprecedented situation is we need to remain flexible and support people with what they need when they need it. Obviously, if this continues for another 6 months, for another year, we will have to continue to make adjustments and extend many programs. But right now, what we're looking at is the short-term support that is needed to get Canadians through this so that we can come out the other side and restart the economy soon. And we won't need to look at what we might need to do in 6 months if we're still, heaven forbid, all locked down still. We want to get through this. We want to get through this quickly, but we know we need to support people right now as we get through this, and that's what this extra help for seniors will help with.
Prime Minister Janet Silver, Global News. Chinese Canadians, including human rights advocate Anastasia Lin, say community members are under pressure from the Chinese government for their influence networks around the world like United Front. They fear for family members back in China if they speak out, and they also say that they don't have any support here in Ottawa. And I'm just wondering what your government is doing to expose and stop the influence of the United Front here in Canada.
The Canadian government has always highlighted concerns around human rights and respect for basic human democracies and liberties with every country that we engage with around the world, including China. At the same time, we are strong supporters and defenders of the right to free speech, the right to protest, the right to express themselves here in Canada and elsewhere around the world. We will continue to defend human rights while at the same time looking to protect Canadians everywhere around the world, and this is something we'll continue to do.
We've always been very clear in our defense of human rights and freedom of expression and freedom of assembly and freedom of demonstration. And we will always defend the Canadians' rights to do that. In many, many different circumstances, we have defended human rights with the Chinese government.
The agreement to shut down the Canada-U.S. border for essential workers, allowing them through, expires next week. A number of provinces like BC and Ontario have said that they don't want that border to reopen. Is there a time period as to how much longer we expect that to be closed, and what's going to be done for the tourism sector that relies so heavily on visitors from the south?
We have every step of the way taken the necessary measures to keep Canadians safe. That has been our priority, and because that has meant negative economic impacts for many sectors across the country, we have moved forward with supports for workers across the country. But our priority needs to be keeping Canadians safe. And that is the spirit in which we have engaged in constant and constructive dialogue with the Americans to talk about shared interests, including the border. And I have no doubt we will have more to say in the coming days on how we continue to move forward in a way that keeps Canadians safe.
Good morning, Prime Minister. Olivia Stefanovich, CBC News. What does Canada need to see on both sides of the border before you consent to allowing non-essential travel?
I think we all are focused right now on ensuring a flattening of the curve, decreasing of the cases of COVID-19 so that we can restart certain sectors of the economy. That must be done gradually. It must be done with tremendous vigilance. And we need to make sure that we have the mechanisms and the materials in place to deal with any further spreads or spikes in COVID-19. Preventing transmission from outside of Canada into Canada once we have controlled the spread within Canada will be an essential part of ensuring that we don't fall back into a second wave that could be as serious as this wave we're going through, or even more so. So we're going to be very, very careful about reopening any international travel, including the United States, before we feel that it is time. Okay. Nous savons que le but de ce que nous vivons maintenant, c'est de protéger
what we're trying to do now is protect Canadians
que la COVID-19
by
se répande
preventing the spread of COVID-19 within Canada. As a result, we must control the transmission between Canadians and ensure that in Canada we are massively reducing the number of cases. That being the case, of course, we will be vulnerable to cases coming in from outside, and that's why we'll have to be very vigilant and extremely attentive as to how we can ensure that COVID-19 does not come into Canada and prevent a second wave that is as bad or worse than the one we're in now. So we will be very attentive and be very cautious when it comes to reopening international travel.
Elected Wet'suwet'en chiefs are calling for the resignation of Crown Indigenous Relations Minister Carolyn Bennett because they say she failed to properly consult with elected leadership over a memorandum of understanding with hereditary chiefs, which they are calling your government to reject. What is your response to these calls from elected leadership? And will the virtual signing scheduled for May 14th of this memorandum of understanding still go ahead?
I want to begin by thanking Minister Bennett for the extraordinary work that she has done over the past months and continues to do on a very difficult issue that has gone on for decades now. The challenges facing the Wet'suwet'en are significant in terms of how they engage and how they work with the federal government, and we will always be there with a partner, to listen, to work with them, and to continue moving forward on the path to reconciliation and partnership.
First of all, I want to thank Minister Bennett for her leadership and for the approach she took in working with the Wet'suwet'en on these very difficult issues that have been around for decades. And as the federal government, we will always be there to work with the community to try and support them and help them to address the challenges they are facing. We know that the path to reconciliation has to go through partnership, and we will be there.
On the Big Business Program for lending, yesterday you said that the federal government will be the lender of last resort to these companies who come to the federal government and ask for money. So that means that banks, private investors, pension funds, they will have presumably said no to these companies. We don't want to invest in you. Do you think that the federal government is taking on too much risk if the market has said no to these big companies already?
I think there are big companies in Canada who employ thousands upon thousands of Canadians for whom the concern that private lenders might have of whether or not it is profitable is not the only issue that a government needs to look at. We know that if significant numbers of Canadians lose their jobs for good because of COVID-19, if big employers go under purely because of COVID-19, because they didn't have the liquidity to make it through this, then our economy not only will be worse off, but we'll have even more trouble getting back to normal and coming roaring back. That is why the government has put forward this large employer emergency financing facility to make sure that those companies that if they were to go under because of COVID-19, and impact on the livelihoods of thousands of Canadians for whom it would not be their fault, our government needs to be there. Okay. We recognize
that there are large corporations that employ thousands and thousands of people, and that there would be a long-term injurious effect on our economy if they failed as a result of COVID-19. As a federal government, we have to be there for workers to ensure not only that our economy can come through this, but that it can rebound afterwards. And therefore, we are going to be there to provide liquidity to companies that cannot find that liquidity on private markets, because we know that the impact on the Canadian economy and on workers is just too great to allow them to fail.
You expect that these companies need to be transparent with the federal government in terms of the tax evasion and other things that they've done. Will you commit that the federal government will be transparent about the program itself and make both the terms of the deal and the amount of money that are given to these companies completely public so Canadians can evaluate the deals that your government has done?
Every step of the way, we have been open and transparent about the aid we've put forward during this unprecedented time, and we will continue to share with Canadians the information on what we are doing to make sure that Canadians are kept safe and that our economy is able to come roaring back afterwards. Merci beaucoup tout le monde.
All right, that is the Prime Minister of Canada on this Tuesday, giving us an update on his government's approach to fighting the pandemic a little bit earlier than usual, because he will be at the COVID-19 virtual committee that gets started at noon Eastern, and we'll bring that to you live as well. Let's bring in my colleagues, Vashi Kapelis and David Cochrane. I cut you both off quickly, and my apologies, because the Prime Minister came out. Obviously, the big announcement today for seniors. Lots of people already tweeting me wanting more information, primarily when is it coming? Vashia, over to you for all that.
Yeah, I was getting the same tweets, Rosie, and so I quickly texted the spokesperson for Minister Schultz, the Minister of Seniors, who said that it will be automatic. So if you are already receiving old age security or the guaranteed income supplement or both, you will automatically get this money, and that will happen within a matter of weeks, as soon as possible. So they don't anticipate any sort of big hang up with that. I know there are some questions about your own eligibility for it, or if you've had it clawed back, or it might be clawed back, does that affect this? I'm working on getting those answers as well, so we'll try and update viewers throughout the day. But the big news is you don't have to, much like the CER, or at the opposite of the CERB or the student benefit, you will not actually have to go into a portal and apply for this. It's automatic. The total cost of the program is about $2.5 billion, and you heard the nature of the questions to both the Prime Minister and the Minister of Seniors. Do they need to do more? Are they considering more? And I thought the Prime Minister's answer was actually interesting, only because we're kind of all clinging to any sign of a prediction about how long this scenario might last. And his answer was that this is the money for right now, and we know that they calculated this amount of money based on increased incremental costs for seniors, like having to take taxis instead of public transportation, or get groceries delivered. But if this were to continue longer, and he used the example of 6 months, if this type of a quote unquote shutdown or lockdown would continue for the next 6 months, then obviously the amount of money or the programs through which that money is delivered could be amended. That is very similar to things that the government has said, and the Prime Minister specifically, about other financial aid measures. We know that there is always the possibility that they are extended. The cost already is quite great when you put it all together. We're looking at a deficit of about $250 billion, and that is just for the next few months. If in fact this type of scenario lasts longer, which is a big if, because we are seeing various provinces reopen at least parts of their economies, it looks like the federal government is signaling, at least, and just signaling, there are no details, that it is prepared to offer more assistance if necessary.
Yeah, and just so lots of people are also asking me, so it's 6.7 million or so Canadians who have the OAS, the old age security, and of that, 2.2 million who are eligible for the guaranteed income supplement. So the people who are really struggling the most, who are going to get the biggest top up here of $500. They have done a couple of other things, the government has, the one-time special payment through the GST, and then they did allow some flexibility around pulling out your RSPs in terms of the minimum withdrawal needed. David, I'm going to get you to talk a little bit about the border there, because I thought the Prime Minister had some interesting things to say on a day when the Senate is hearing from the head of the CDC and Dr. Fauci about how the U.S. is far from out of the woods yet.
Yeah, the deal to keep the border closed, everything except essential traffic, expires on the 21st of May, but it sure doesn't sound like there's any rush to reopen that beyond the current conditions that are in place right now. I mean, there may be, as the Deputy Prime Minister Chrystia Freeland suggested, a relaxing or a broadening of what constitutes essential travel as more economic activity returns to normal, but the usual sort of free-for-all of Canadians and Americans crossing that border seems a long way away. Like a lot of things seem right now, Rosie, a long way away. It seems like this could go on to the point that the three of us will be qualifying for OAS at a certain point. But I want to just go back to that about the aid announced for seniors, because one of the persistent questions has been, why has it taken so long to get to direct financial aid for people who are on fixed incomes? And that kind of answers the question. If you look at this response as sort of an economic emergency room where the government has had to do triage on absolutely everything, it's the people who lost all of their income, who needed the immediate and urgent help. And that's where things like the CERB and EI things came into place, because it was a catastrophic loss of income. What you've seen with seniors, most seniors, not all seniors, is an incremental erosion of their buying power and an incremental increase of their expenses. And this is why, because the fixed income meant there was no catastrophic drop in their income, it was a gradual rise to things like dispensing fees, because you can't get 3 months of prescriptions now, you can only get 1 month. So you have to do that and make 3 separate trips and all these sorts of things. This is why it has taken a little bit longer. And as to the questions of why only a one-time payment, it was similar to what we saw with the Canada Child Benefit, where families got up to $300 per child as a one-time payment. I was just speaking with someone in the Prime Minister's office. These are buttons they can press again and again and again as needed. They needed to create whole new programs for things like the Canada Emergency Response Benefit and the wage subsidy to put that floor under the vast majority, more than, I think it's about 9.5 million Canadians that are getting aid right now through both of those programs. The seniors' pension levels were largely unaffected by this. This is different, I know, if you are relying on market investments, and that is a whole other conversation. But it just took a little bit longer to get to this point. But they know, and when the Prime Minister says, God forbid, and God forbid indeed, if we're still locked down in 6 months, they can do more here by pressing these buttons. They can make changes to RRSP withdrawals and things like that. So a first big step for seniors here. I don't know if this will be the entirety of what we see in terms of support for people over the age of 65.
Okay, thank you both. I'm going to come back to you if you don't mind. I will also just mention, because I also did get this question, if you get the OAS top up per couple or per individual. So old age security is not calculated per couple, it's per individual. So if you are living with your husband or wife, you will get $300 each. It's different than the GST, which is based on a couple. So in case you were wondering about that too. So let's bring in someone who's actually been wanting to hear more about that. And that's Joan McDougall. She's retired and she relies on her investment income. And we've reached her in Halifax. Joan, nice to see you. How you doing?
I'm fine. Thank you very much.
Good. So you were listening to all these announcements this morning. I know you've been on sort of red alert for some news for seniors. What do you make of what the Prime Minister and the ministers had to say?
Well, it's interesting because the Prime Minister has been saying, at least for a month, probably 2 months now, that he has our back as Canadians. And actually, after today's announcement, my back still feels a bit breezy, if you will. The announcement itself, or the announcements, I think are positive. Every little bit counts when you're on a fixed income. And that's good. It does help to offset some of the rising costs that we're seeing. But there was an election promise to increase OAS by 10%. Sure was, yeah. This was back in the fall. And also for widows' benefits by 25%. Nothing was said about that today. And I know he indicated this is a short term and it's a step, hopefully a stepped approach. But I would wonder, is that still going to happen? Both of those benefits would impact me significantly, and I think for many seniors as well. My worry, I guess, is more deeper or long term. I'm one of the lucky seniors. My day-to-day expenses haven't really been impacted that much. I can still manage them. So my worry is deeper and maybe a little bit long term, like was just mentioned. I think it has to do with the crisis in the financial market, where we've been saving and have invested our retirement savings. And with that instability that we're seeing, that's what causes me the stress.
Yeah,
and
sure.
I'm hoping that that will be addressed to some extent. I would have loved to seen today something like having the choice that we could have left all of our RIFs invested, because not only would you get a bit of a tax deferral next year, but also it would allow time for my portfolio to recover a bit, hopefully, and to heal. And we don't really know. The Prime Minister mentioned today 6 months. That kind of jolted me. I think I've kind of been thinking 3 months.
Yes.
6 months would be, that has a lot more impact. And, you know, most seniors, myself included, I think one of our main goals, if you will, is to live independently as long as we can. And to do that, you need to have market stability in the money that you've invested, no matter how small or how large it is. I would have liked to have seen a little bit more addressing of that, and maybe that will happen in the next few days.
Well, you're certainly well briefed here, Joan. I must say you do follow this closely. I will say that they did make that little change on the RIFs by reducing the minimum withdrawals by 25% for this year, but I understand what you're saying. And you're quite right that they promised to do more for old age security. They said that they would increase it by 10% once a senior turns 75. And they promised to do that actually by July. And that would have been more significant than what they've announced as a one-time payment today. So that is worth asking, certainly the government, whether they intend to follow through with that, and whether that couldn't solve some of the problems that we're dealing with here. So you said your income, rather your spending, hasn't really increased significantly. So what is the main concern for you then? It's that you can't sort of budget, not knowing that you have, you know, some of your money in the markets, and you're a little worried about that?
Yeah, I guess that is my crunch. My money is basically invested. Maybe I would have been better to put it under my mattress. I don't know, but. That's my worry. It's more of a little bit of a long term. I'm going to be 75 in October, so I'm getting up there where you can look ahead and hope that you're going to have enough to live on, certainly, and maybe to get a little bit left over for your kids or your grandkids. So that worry is mine. Short term, yes, I am seeing some rising costs in food, flour in particular, and things like that. But for me, I guess I'm a lucky senior that I don't rely on that as a day-to-day. I haven't noticed a lot. I'm not spending a lot because I'm staying at home, basically.
That's right.
That can change as the market opens.
Sure.
You know, so I'll count my chickens yet, but that's the situation.
How are you doing just in terms of living with this? You said you've got kids, you've got grandkids. I'm not sure if you have been able to see them yet, given the situation in Nova Scotia, which is not too bad right now. How are you coping with it emotionally, mentally, if you don't mind me asking?
Yeah, I'm pretty good, I guess. I'm basically coping. My son lives in Edinburgh in England. I'm more worried about him because it's a bad situation there, but we're able to get online and chat. My daughter lives pretty close to me, and she has 2 young grandchildren. I've found that a lot harder. I have recently been going over doing some backyard visits, if you will. At first, the kids were up on their deck, and I was down in the yard. And we're venturing a little bit closer. You know, they now are down in the yard. So that's good, but you still can't give them a hug. You can't promise a sleepover. You can't sit and read with them, all the things that as a grandparent you love to do. That's right. So that's hard. You know, and I think they always say that with older people, isolation is harder, and I think it really is, and especially as it relates to your family when they're quite close. It's a big change for everybody.
Yeah. Can I ask, I had a man on last week, a senior, older than you, but also living at home and doing very well. Do you worry, given what you're seeing with long-term care centers, about your future and how that might be managed? Or have you thought about, you know, the fact that you would want to stay in your house much longer? Because it is a sort of scary situation, I think, for a lot of people right now.
Oh, absolutely. I think that my mother died last year prior to COVID, and she was 98, and she lived in a long-term care facility, and she got excellent care. But I recognized at the time those poor people, the staff were run off their feet, and they were underpaid. Most of them had to take 2 or 3 jobs. And as for myself, I mean, and most seniors, I want to be as independent as I can for as long as I can. And seeing on a first, seeing that up close with my mom made me want to put it off to as long as I can. But I mean, basically, the important thing is that the governments or collective governments do something to rectify that situation. It was heartbreaking to see all these people dying on their own in these homes, but really jolting for somebody in their mid-70s for myself, because, I expected, or I assumed that at the, there will be some time, my end of years, if you will, that I would be in these homes too, and I assumed they would be safe. And I also assumed that I'd have enough money to see me through, to tide me over for my needs, and then have a little bit left over. So I really think that's the important thing, that we get that situation in these homes taken care of. I think a lot of it has to do with the age of the homes and the buildings themselves. My mom was in 2 separate nursing homes. One had a much better building structure, and that made a huge difference in the care. For example, the nurses could see all the people in their little unit from where their station was. In the newer home where Mom went to, that wasn't possible. So, and then you have these homes that in Halifax, for example, where we're having terrible difficulties. I think that's a 10 or 11-story apartment building, if you will. Very narrow hallways. And I did go in there to visit a friend last year. I was shocked, because all I could think of was if there was ever a fire in that building, how would they ever get out? And there was a situation where the 2 seniors, the ones that I was visiting, or the lady that I was visiting, I don't think she could get up at the same time in the morning as her roommate, because it was so narrow. It's a terrible way to end up. So I think that's a really important thing for everybody, collectively, for seniors, and I do worry about it. I'm just hoping that I'll be able to put that situation off as long as I can.
Well, you look like you're nowhere near there, so I'm glad to see that. And I will try to get you an answer on what the government plans to do with OAS with their election promise. I promise to do that for you. Joan, thank you for talking to us. It was good chatting with you, and I wish you good health and hope you get to see your grandkids pretty soon.
Thank you.
Thanks,
Good
Joan.
health to you.
Thank you. That's Joan McDougall in Halifax, a senior who was just reacting to the news today that the government is increasing, giving you a one-time tax-free benefit if you have old age security of $300 and an additional $200 if you are on a guaranteed income supplement. But I want to turn our attention to someone else who's doing something different than usual right now as we all try to find ways to pitch in and help in different ways in our communities. And this is Saskatchewan's opposition leader. He's dusted off his stethoscope and returned to practicing medicine to help in the fight. Dr. Ryan Maley is, he's currently the MLA for Saskatoon-Mewasan and the leader of the New Democratic Party there, and he joins us from Saskatoon. Good to see you.
Good to see you, Rosemary. How are you doing today? I
am good. So I think you're in your political office there, in your actual job office. Tell me, though, why you decided to do this.
We're just seeing so many people stepping up in so many exceptional ways across the province, across the country. And I certainly wanted to be part of the effort in responding to COVID-19. Having the family medicine training, I wanted to be able to help out and be part of the team that's responding to COVID-19, especially in the core neighborhoods in the inner city in Saskatoon where I live and work.
And what have you been doing? If you're a family physician, have they just thrown you in there, or what kinds of things have you been doing?
Kind of just thrown me in there. I'm working at a COVID assessment and testing site at an inner city school. So there we test people for COVID-19 as well as address any other health needs they might have. And I also work at the Lighthouse, which is the largest housing shelter in Saskatoon, and I'm doing a weekly clinic there as well.
And were you concerned at any point about your own safety? Did you contemplate the risk involved in doing this?
Certainly, we had those conversations. My wife's a pediatrician, so she's working with patients as well. And we've got 2 little kids, so we want to make sure that we're able to keep taking care of them, really that comes down to the same kind of risks that everyone's taking in healthcare as well, though, and just means being really careful, making sure that we're using the right protection and being cautious about cleaning up when we come home, etc. But we know it's a risk. We could wind up catching COVID-19, and that's the same risk anybody who's working in healthcare right now takes.
What about this virus do you find so disturbing, either from something you've seen up close or things that you're hearing?
You know, it's just such an invisible threat, right? It's something that can catch up with people, and it's so hard to know, and so you have to be constantly vigilant. Think about the community of La Loche, where it's far in the north. People probably thought, it's unlikely to come there, and now it's the worst community outbreak in the country, and it's just such a sneaky virus, and we have to be so careful to avoid getting it.
Well, that leads me to get you to put on your other hat, not the stethoscope, but your politician hat. And Saskatchewan has done, pretty well in terms of containing the outbreak there. I'm not sure how many cases you have today. Perhaps you know offhand. But what is your assessment of the reopening strategy the Premier has put in place, given that in northern Saskatchewan there is something different happening there?
I think that northern situation really, the La Loche area situation, really needs to give us pause and make sure that we're approaching this reopening really carefully, understanding what the cues will be to back off if we start to see a big spike in cases. And that's my big hope, is that the Premier and the leadership will make sure that they're being led by data and not by dates, that they're not locked in, we want to do this by such and such a date, but they're making sure they're watching the caseload and they're ready to pull back if we do see an increase. We all want to see the economy open up again. We all want to be interacting with our friends and neighbors and shopping and doing all of those normal parts of life, but we want to make sure that that's done in a way that's really, really safe.
Okay. Ryan Mealy, it's always so good to talk to people who have these other professions, decide to get back in them to help out, and I commend you for that. Nice of you to make the time. Appreciate it.
Great. Thanks so much. Have a great day.
Thank you. You too. Thanks for speaking with me. All right, as we've been talking about, the government's announcement today really focused on seniors, $2.5 billion to help many seniors who get old age security and guaranteed income supplement. We'll talk about that and more after we take a short break. The COVID committee in Parliament is sitting at the top of the clock. We'll bring you that too. I'm Rosemary Barton. This is CBC News Network. Hi again, I'm Rosemary Barton here in the nation's capital. Thanks for joining us on CBC News Network, streaming wherever you are on our app or CBC.ca. This hour, millions of older Canadians can expect to see a bit more money in their bank accounts, at least one time. The Prime Minister just announced new measures to support seniors during the pandemic, $2.5 billion in financial aid to help offset some particular extra costs that may have happened. Justin Trudeau also said COVID-19 has exposed failures in how we care for seniors. We've talked a lot about that, and the federal government says it will continue to work with the provinces to find some lasting solutions. We're going to hear more from federal ministers and the Prime Minister any moment now as the COVID-19 committee ramps up its virtual session at around noon. But before we get to that, I'll bring in my colleagues, the CBC's David Cochrane and the host of Power and Politics, Vashi Kapelos, for another just take on what we've heard there from ministers and the Prime Minister. Vashi, you had some more details because Joan was great. Joan, our guest, she knew a lot, and she also brought up the point that I had wanted to talk about too, which was the promise that the Liberals made about old age security during the election, that they were going to increase it soon. I think it was in July. It was the intent.
Yes, that is the idea. Both she and you reminded me of that promise rather than that the Liberals made. I believe it was back in September of last year, and it was a two-part promise directly addressing seniors' issues with income support. So with the OAS, you were going to get, once you turn 75, a 10% increase. And then with the CPP, there's a survivor's benefit for widows, and they had promised to increase that by 25%. My understanding is, and I couldn't find the date for the CPP promise, but you're right, for the OAS promise, that was supposed to happen in July. So while you were talking to Joan, I got on the horn and I tried to find out from the government, is this going ahead? And the bottom line is no, that it's not. And I think that is significant because I think it was supposed to lead to an increase of more than $700, extra $729 each year. And the promise from the Liberals was that it would lift 20,000 seniors out of poverty. Now, they aren't saying it's never going to happen, but the response I got was that they are focused on these measures specifically as they relate to the pandemic and addressing the need that has arisen because of the pandemic. And so reading between the lines, that means that this is not coming in July. I don't know when it is coming. They promise that it is at some point. But I think that, to Joan's point, that is interesting for a number of seniors who are going to benefit from what they're promising right now with the pandemic. Yes, it is this one-time payment. It is supposed to address the incremental cost, but there was sort of an overall feeling in the election that the cost of living for seniors was already increasing and that there needed to be more done. This specific promise was made. The $500 that they're getting at a max now is not even going to match the over $700 they would have received if this promise had been followed through on.
And you sort of wonder if you were going to do it anyway, and it doesn't require legislation. I understand we're in the middle of a pandemic, but why not just go ahead and do it so that additional bit of money comes to Joan and people like her? Anyway, David, over to you, maybe.
Yeah, Rosie, this is one of the things, though, that the government is dealing with. It made a lot of promises in the election, and the world has been turned upside down. And, I was talking to people last week about these enormous deficits the country is now going to run and facing, and sort of the plan for getting these things under control. And really, the deficit spending is going to continue well into the economic recovery phase. We were talking about the border reopening earlier. You can't really have an economic recovery in Canada until you have a public health recovery in the United States, because it is such a driver of global commerce and trade, and we are so intertwined economically with the United States. Until things get to some sort of normal down there, they're not really going to get to growth phase up here. And so that one of the issues they are now looking at is going slower on a lot of the election promises. I mean, at no point did they consider that 45% of the Canadian workforce would be either on emergency benefits or on a wage subsidy, as we head into the summer season in the country. So a lot of things they promised to do. You have to wonder where pharmacare is going to go, for example. This is a big multi-billion-dollar annual ticket item that they campaigned on, were elected on, and promised to do with support from some of the other opposition parties, depending on form and substance of the program. How do you move ahead with something like that when you have 7.7 million people getting the CERB and another 1.8, 1.9 qualifying for the wage subsidy. So a lot of these things that they promised, they have to go slower on because of the spike in pandemic costs.
Yeah, all good points. And I would also say, if you're, do you move forward with pharmacare if you know you've got a long-term care crisis, or do you start to put the focus
there? That's a whole new issue that's been put on the table.
And think maybe that the money should go there. Just back to the border, if I can, because my wonderful producer Phil, who you all know now, said that yesterday, obviously, BC raised some issues around this as well. This is another province raising the issues that we've heard over the past number of days. And I didn't know this, but more than 2,500 Americans were actually turned away from trying to get into Canada between March 22nd and March 3rd because it was deemed that their travel was non-essential. So it is a live issue for premiers, and it's obviously an issue for travelers. There are people who are still not really understanding that traveling across the border is not wise right now. Vashi, I'll get you to weigh in before I jump into the briefing.
Yeah, I think what's so interesting, Rosie, as we head into the deadline for the sort of second iteration of this agreement expiring, is the fact that south of the border, the conditions have changed. Many of the states have, to a degree, reopened their economies. Not all of them by any means, but certainly a lot of them. And to the Deputy Prime Minister's point, that will likely increase traffic. So what does that mean for the federal government here? Does that mean that they try and keep the agreement in place? That it very much sounds like all the premiers are, most of the premiers are on board with that. In fact, the word that Doug Ford used last week was he's adamant. He does not want those restrictions lifted. But you have to wonder what the conversation is like behind the scenes. And even if there is agreement, if in fact economies south of the border are reopening and there is an increase in traffic, what does that mean for the border itself? Do we have the resources there needed to screen those people, to turn them away if necessary? If in March the numbers were already that high for turning people back, you got to wonder when the restrictions are lifted, what's going to happen, or if they're lifted, or if sort of economies reopen south of the border, what that means for traffic at the border. I think it just becomes a more complicated live issue for the government, as we're not in this sort of shutdown, lockdown mode, and there are these changes on both sides of the border that kind of ultimately change the discussion too.
Yeah, I mean, I found that the Prime Minister's words today were far more definitive than they had been in the past, that this is about preventing transmission from the outside to the inside, he said. That'll be an essential part of how we evaluate how we do this, and we will be very, very careful about international travel, including the U.S. Before we feel it is time, we won't do anything. But as David's mentioned in the past, the pressure on the American president and the pressure maybe exerted by the American president is another complication to all of this. Okay, we are going to go to the briefing of Dr. Tam, the Chief Public Health Officer, right now, and we will shortly take you inside the COVID-19 committee when it gets underway. Let's listen in.
And recognize among these, including personal support workers, orderlies, and patient attendants have lost their lives due to complications of COVID-19. Remember, on this 200th anniversary of Florence Nightingale's birth, shine a light in your window to thank our nurses for the valuable work they do, but make it extra bright for all those who work alongside them around the clock to be there for us when we need them most. Thank you. Merci.
Bonjour. Comme d'habitude,
Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 70,342 confirmed cases, including 5,149 deaths and 33,254, or 47% now recovered. Labs across Canada have tested over 1,145,000 people for COVID-19, with about 6% of these testing positive. We are now testing an average of 26 to 28,000 people a day. These numbers change quickly and are updated regularly on the website canada.ca/coronavirus. Last week, I mentioned the disproportionate impact and severe outcomes of COVID-19 on our seniors, particularly those residing in long-term care and assisted living facilities. An estimated 20% of Canada's COVID-19 cases are linked to long-term care homes, but over 80% of all deaths are among seniors residing in those settings. I reiterate these numbers today because not only do they lend a voice to the unspeakable scale of the impact on our seniors, but they also highlight the challenges faced by healthcare staff working in these settings. These people include nurses, who we are celebrating on this National Nurses Week, but also the personal support workers and the many other essential staff that deliver care and services to our elders, parents, and grandparents. In our long-term care homes, healthcare workers not only deliver health and personal care services, they also establish familiarity and friendships, they offer companionship, and they have personal interaction and provide simple human kindness, all of which is as vital to well-being as any medicine. During the COVID-19 pandemic, their work has become immeasurably harder. Nevertheless, they have shown up. And despite staffing shortages and their own fears, they've worked long hours, they've taken extra shifts, and in some cases, they have isolated from their own families. Tragically, some of the least compensated and recognized of these workers, including personal support workers, orderlies, and patient attendants, have lost their lives due to complications of COVID-19. Remember, on this 200th anniversary
we're going to
of
pull
Florence
away from this
Nightingale's
federal briefing, if you don't mind. You can watch it on our website. But we will go now to the virtual COVID committee, as that is where we expect to find the Prime Minister and other federal ministers taking questions. Let's listen in live now.
Our focus from the very beginning has been to get the help out Prime Minister Canadians. I think I'm off mute. No, can you hear me? We're good now. Go ahead. Thank you, Mr. Speaker. Our priority from the very beginning has been to make sure that Canadians get the support they need. We moved very quickly to get the Canada Emergency Response Benefit out, to get the wage subsidy out, to help Canadians in this unprecedented situation. We recognize that there will be challenges, and we're going to work through those challenges. But our priority every step of the way was to make sure we helped as many Canadians as possible. We'll go very quickly.
Mr. Albus now. Mr. Speaker, can the Prime Minister confirm that the instruction has been given to federal employees to ignore these 200,000 applications as being flagged as potentially fraudulent? This is important.
Right, Honourable Prime Minister. Our focus has been on helping as many people as we possibly can. Our decision from the very beginning was get the help out to people and figure out with retroactive action, if necessary, where and when there has been or there may have been fraudulent use. Now our priority was getting that help out.
Next question. Mr. Speaker, this came from a memo issued by a deputy minister. Did the minister's office or the Prime Minister sign off on this memo?
The Right Honourable Prime Minister. Again, in this unprecedented situation, our focus has been on helping as many people as possible, as quickly as possible. Other people, other parties might have made a different choice had they been in government, but our focus was getting help out to people when they needed it as quickly as possible and cleaning it up afterwards.
Mr. Speaker, I asked a very simple question. Did the Prime Minister or his minister sign off on this memo that was issued by the Deputy Minister, yes or no?
The Right Honourable Prime Minister. Mr. Speaker, we have been focused entirely on getting help out to Canadians when they need it. And that has meant that, yes, there will be things we need to clean up after the fact and work to fix. But getting that help into Canadians' pockets during this pandemic was our priority.
We'll go back to Mr. Albus now. I'm asking the Prime Minister to show some accountability. Did he or his office sign off on this memo?
The Right Honourable Prime Minister. Mr. Speaker, my office and I have been absolutely focused on getting the help to Canadians that was necessary. Perhaps, as Mr. Albus points out, other parties would have been slower to get the money out. We were flowing money to people who needed it.
Mr. Speaker, the question was quite simple, and obviously the Prime Minister doesn't seem comfortable with the answer. Will he at least then commit to investigating every individual case of fraud, or will he write it off, as the story is said?
The Right Honourable Prime Minister.
Mr. Speaker, in this unprecedented situation, Canadians have lost their jobs, Canadians have lost their paychecks, don't know how they're going to be able to support their loved ones and pay for their groceries. We made a decision as a country that we would be there for them, and that has been and will continue to be our priority.
Back to Mr. Elbis.
Mr. Speaker, the Prime Minister can leave the cottage talk for the cottage. We're asking a very simple question here. Will he commit as a government to enforce the rule of law and to enforce the attestation that says that if someone commits fraud, that it will be followed up and pursued?
The Right Honourable Prime Minister.
My commitment as Prime Minister and as a government is to support Canadians, is to protect them. And that is what we are doing by giving them the support they need through this unprecedented situation. Perhaps other parties don't think it's as important to support Canadians. We will keep focused on supporting Canadians.
That's not what I'm asking here, Mr. Speaker. Conservatives supported the legislation that allowed those supports to go through. What we are asking about is fraud. All along, we've been told fraud will be detected through audits after the fact, and expect that to happen. Can the Prime Minister at least confirm that this will happen?
The Right Honourable Prime Minister.
When we made the determination that we needed to move quickly to help Canadians, we knew that there would be a need to clean up after the fact, to go after fraudulent cases, and we will do that. But our priority now and in the coming months is to ensure Canadians get the support they need and our economy comes roaring back. That's what we're focused on.
Nous allons continuer maintenant. Attends une minute, on va changer de langue.
We will now be continuing with Mr. Sainte-Marie. Thank you, Mr. Chair. Yesterday, the Prime Minister announced large employers' emergency financing facility. Great. Even better, he announced that these loans were conditional. One of the conditions forces companies to not be guilty of tax evasion or avoidance using tax havens. Wow. Unfortunately, I was quickly disillusioned. It's rather abusive tax evasion or avoidance that we're talking about, so fraudsters, but nothing to put pressures on profiteers, businesses that take advantage of tax havens to avoid paying their taxes, but who do so legally will still have access to this emergency credit. Why is the Prime Minister continuing to support profiteers? The Right Honourable Prime Minister. We will always be here to fight against tax evasion, and that has always been a priority of the Liberal government. But our priority in this situation is employees, workers across the country who may lose their jobs, who have lost their jobs. That is why we are moving forward with measures to support workers, and that will continue to be our priority. Mr. Sainte-Marie. Yes, thank you, Mr. Chair. When I hear the Prime Minister say no tolerance for tax avoidance, I am thrilled, or tax evasion. But unfortunately, that's not the reality on the ground. Tax avoidance is the legal use of tax strategies. All 5 major banks take advantage of it, big corporations and multinationals take advantage of it. We have to fight back against these companies. They have to do their part. Can the Prime Minister and the government act to make illegal what is immoral? The Right Honourable Prime Minister. Thank you, Mr. Chair. When we announced the Large Employers Emergency Financing Facility, we said that those who wish to reserve the taxpayers' money under these exceptional circumstances have to have contributed by paying their fair share of taxes. That is why we are putting in place measures that look closely at the tax structures of these companies before lending money to them. Mr. Sainte-Marie. Yes, thank you, Mr. Chair. When a bank moves its most profitable activities elsewhere in Canada, they're in Canada, but they're registered in the Bahamas or Barbados or another tax haven, do they consider that that company is doing its fair share and paying taxes in Canada? Thank you, Right Honourable Prime Minister. Thank you, Mr. Chair. We will be assessing on a case-by-case basis the applications for the Large Employers Emergency Financing Facility. We do not expect the major banks to access these funds, but we will ensure that whoever does apply for these funds is transparent with the way that they are managing their money, including their international operations, before we lend them money. Mr. Sainte-Marie, yes, thank you, Mr. Chair. Now, consumers are paying more and more with their credit cards. That allows them to do contactless payments in businesses and to purchase more products online, which is very profitable for Visa and MasterCard, who charge unbelievably high fees, almost 10 times what people pay in Europe and in Australia. It's costing our retailers a fortune. Can the Prime Minister do the same thing as was done in Europe and Australia and limit the interchange fees to 0.3%? Thank you. Right Honourable Prime Minister. Thank you, Mr. Chair. We are always seeking to reduce costs for consumers. We are working with the financial institutions and the major banks to find help and provide access to people who need it. We're always looking at ways to lower costs for consumers, but right now we are sending money to consumers who need it the most across the country to get through this crisis, and that is what we shall continue to have as a priority. Mr. Sainte-Marie. Yes, the question wasn't about consumers, but about retailers. A credit card that charges 2.5–3% per transaction it lowers profit margins and enriches our credit card companies to the detriment of our retailers. I invite our Prime Ministers to be inspired by practices employed in Europe and Australia and limit the interchange fees to 0.3%. Right Honourable Prime Minister, we are continuing to work with the major banks and credit card companies to help consumers during these exceptional and difficult circumstances. Of course, there are things that we'll be able to look at in the longer term as well. Thank you.
Thank you, Mr. Speaker. Instead of providing a universal direct payment for all, the government has decided to implement a complicated program that leaves many people behind. A single parent with 4 school-aged children lost their spousal and child support due to COVID-19. She pays taxes on her spousal income, but she's not eligible for CERB. The Minister of Employment says she's looking into this gap. It has been more than weeks, still no action. Will the Prime Minister step in and fix this gap so that the single parents and their children can get the support they need during this pandemic?
The Right Honourable Prime Minister.
I'm happy, Mr. Speaker, to correct the honourable member to point out that we actually moved in the most rapid and simplest possible way in providing income replacement to millions upon millions of Canadians who needed it with the Canada Emergency Response Benefit. However, as the member points out, when one moves quickly and efficiently, there will be gaps, and that's why we've been working diligently to try and fill those gaps. We want to make sure that Canadians who need help get it.
Ms. Kwan.
Well, the Minister of Employment has been aware of this for 3 weeks. She says she was looking into it, and still there's no action. The truth of the matter is single parents and their children, depending on spousal support and child maintenance, are not getting support. Will the Prime Minister fix this gap?
The Right Honourable Prime Minister.
We recognize the particular challenge faced by families, by single parents, by families with young children, which is why we increased the amount of the Canada Child Benefit to be able to support people in this particular moment. On top of that, we have looked to fill further gaps that have existed with the Canada Emergency Response Benefit. Well over 7 million Canadians have access to the CERB. We will continue to work with them.
That does not replace spousal and child maintenance, Prime Minister. Across the country, there is no national standard to address the homelessness crisis amidst the pandemic, leaving communities at heightened risk for COVID-19. Canadians who are homeless or living in substandard housing have no access to bathroom facilities for basic hygiene. Those living in crowded SROs and shelters cannot practice social distancing. The problem is particularly acute in my riding in the downtown east side. While the BC government has implemented an initiative to house some of the homeless population in empty hotels in the short term, support from the federal government is needed to secure permanent solutions post-COVID-19. Will the Prime Minister commit to providing matching funds and take the right to adequate housing seriously?
The Right Honourable Prime Minister.
I know the honourable member wouldn't want to have inadvertently misled the House. The fact is, the federal government almost immediately sent significant hundreds of millions of dollars of resources to shelters across the country to enable them to create facilities, including renting new spaces, to be able to house people who are homeless without increasing the danger of the spread of COVID-19. I recognize there's always more to do, but as we demonstrated with our national housing strategy, we are serious about fighting homelessness and supporting vulnerable Canadians, and we will continue to.
Ms. Kwan.
The Prime Minister must know that the money that the federal government sent is deficient. Many people still remain homeless and they are at risk. Cutting chronic homelessness by 50% over the next decade is not good enough. And that is this Prime Minister's national housing strategy. Will the government stop just making empty promises and ensure every Canadian has the right to housing? And will he top up the support for provinces to at least matching their funds?
The Right Honourable Prime Minister.
Mr. Speaker, cutting chronic homelessness by 50% is an ambitious goal that no one else has ever been able to do as a government, and we are well on track for it. And I would suggest that the member opposite not dismiss that as empty promises, because we have demonstrated the actions on it. But I recognize there is more to do. There is always more to do. And we will be there, continue to be there for vulnerable people, including homeless Canadians.
Well,
Ms. Kwan.
I would remind the Prime Minister it was the federal Liberals who actually eliminated the National Affordable Housing Program in 1993. And so we have this homeless crisis today as a result of the Liberals. We in Vancouver East have the third largest urban Indigenous population in the country, yet we got less than 2% of the pandemic urban Indigenous housing funding. They're overrepresented amongst the homeless population. Why?
The Right Honourable Prime Minister.
Mr. Speaker, we recognize there is more to do on supporting urban Indigenous peoples. We have moved forward both through the Minister of Indigenous Services and the Minister of Crown Indigenous Relationship to address the challenges facing urban Aboriginal populations. We will continue to work with them to recognize that these are amongst the most vulnerable people in Canada who deserve the right support from all orders of government, and we will be there to support them increasingly over the coming years.
Ms. Bergen.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm hearing in my riding of Portage-Lisgar that individuals who are dealing with Service Canada through the mail are experiencing delays, and it seems that the mail that's going to Service Canada is not being opened. In fact, one of my constituents sent documents, including a doctor's note 2 months ago on March 12th, and is being told now she must resend those documents because they've never been opened. Can the government tell us, is this a widespread problem, and how are they dealing with unopened mail that's happening at Service Canada?
The Honourable Minister.
Mr. Speaker, I want to assure the honourable member that we are doing everything that we can in Service Canada to meet the expectations of Canadians. In the context of COVID-19 pandemic, we've had unprecedented volumes, but we have redeployed thousands of staff to frontline services by phone and by other means. We had to close a number of the centres because of COVID-19 concerns and the safety and well-being of Canadians.
Ms. Bergen.
Thank you, Mr. Speaker. So is the minister aware, is this a widespread problem? Is this happening rarely or frequently? I'm hearing about it. I know for many MPs, we are at the front lines of dealing and helping with constituents who are not only wanting to get support, but are also trying to get programs unrelated to COVID-19. Is unopened mail a widespread problem at Service Canada?
Mr. Speaker, I'm happy to look into the particular case that the honourable member brings up. I am not aware of unopened mail to be a widespread issue. In this particular case, I'm happy to work with the honourable member to see what happened in this individual case.
Ms. Bergen.
Okay, we're going to pull away from the COVID-19 committee and talk with my colleagues, Vashi Kapelis and David Cochrane. There's an interesting and useful exchange potentially off the top between the Prime Minister and Conservative MP Dan Elbas related to some reporting the National Post did today about fraudulent CERB claims. It's something our colleague Catherine Cullen has also done some reporting on. And it was interesting to hear what the Prime Minister had to say or didn't have to say on that, Vashi.
Yeah, it was a Conservative MP, Dan Elbas, I believe, who was questioning the Prime Minister on his level of involvement in what, according to the National Post, is a memo that almost amounts to a directive to staff who are dealing with the claims for the CERB to basically do not impose, the quote is, do not impose a stop pay. So the idea being that if there are fraudulent claims, at this point, get the money out. Don't prohibit that money from getting out. The difficulty, I guess, or the questions that I have are around, well, how you know the claims are fraudulent, how do you assess that, what is the mechanism for doing so? And those were some of the questions to the Prime Minister, too, because the reporting from the National Post says that there's about, or the guesstimate or the estimate at this time is about 200,000, potentially, up to 200,000 fraudulent claims, which would obviously be, if that's $2,000 per claim over a number of months, we're talking a lot of money here. The Prime Minister was asked whether or not his name was on the memo, whether he endorsed the memo. He would not directly answer that question. What he did say was, and what we've heard from Employment Minister Carla Qualtrough in the past, is that basically this will be a sort of don't ask now, recoup money later type of policy. I think there are genuine questions to be asked about how that will work going forward. I noticed, for example, on the you have to log into My CRA in order to reapply for it each month, and there's now a button there that you can press if you need to repay any money. My guess is that whole system, though, the way in which you figure out whether somebody shouldn't have received it, I don't even know how many are intentional. There could be some that are doing it by mistake because they don't understand the qualifying factors. Remember that you just have to basically check a couple boxes on a page to say, I haven't been working for 14 days during this. I am eligible because, just very simple questions. So, if the scope is 200,000 people, that's a big problem for the government. And there are some very genuine questions about what happens going forward. And I think the questions to the Prime Minister were more so about this memo. Should this be the directive at this point? Should they, in fact, be just handing out money rather than stopping the money before it gets out to what amounts to fraudulent claims? And as I mentioned, the Prime Minister reiterated what we've heard from ministers, which is the policy is get the money out right now, ask questions later.
Yeah, I think he said there'll be things we need to clean up after the fact. I mean, I think you would probably get questions if you had done it the opposite way too. If you had said, no, we're gonna verify everything that you've told us here and take 2 weeks to get you the money, as opposed to the way they're doing it now. But I don't think, and I mentioned this yesterday, David, because the next round of CERB is up online now, and you have to apply for it every month. If, for instance, you know that your company is hiring you back under the wage subsidy program, and you apply for the CERB, expect for the government to come calling at some point. I don't know how aggressive they will be around that, but this is not a free lottery situation. There can be and will be, according to the government anyway, follow up on this.
Yeah, this was always intended, the way from rollout, Rosie, this was intended to be a post-payment compliance process. Essentially the same thing with the wage subsidy. I mean, we remember the Prime Minister at the steps at Rideau College saying, if you're thinking about taking advantage of this, don't. That was his warning to employers on the wage subsidy. It's a similar sort of thing here. So I think the fact that there is fraud is not surprising. The 200,000 claims times 2,000, that's $400 million a month. So you spread that out over the 16 weeks of the program, that's going to be about $1.6 billion in fraudulent payments if the math and the memo that the National Post has obtained and is reporting is in fact accurate. And as big as those numbers are, it's actually quite a small percentage of the total value of what this program is and what it is intended to do. But all of these things, because of the urgent need to rush it out so fast, so it's always going to be an after-the-fact compliance process. If you get this money, it will be tied to your social insurance number. It will be caught at tax filing time next year, is what the government has been saying. So you may be pulling a fast one on the government now, and money may be going out the door that shouldn't be going out the door. But the intention is, because of the way these payments are made, is that it will be caught and it will be clawed back, or you will be dragged into court or forced to deal with it after the fact if you knowingly sign up for a benefit you do not qualify for and are not supposed to get. So I suspect the vigorousness at which all of this is pursued when the dust settles on this pandemic will be the true test of this for the government. They set up a program that they knew and said from the very beginning would lead to people getting money they didn't need and didn't qualify for. It's how they deal with this after the fact in the reclamation of these unnecessary funds that is going to be the true test of the integrity of this program.
Yeah, and as Vashi rightly points out, of course, there's a real difference between knowingly doing this, knowing that you shouldn't be doing it, and making a mistake, because it is hard for people to navigate, and you don't know what's going to happen in the next couple of weeks in your life. So I don't want people to run around panicking either.
They're coming for you. No, I'm kidding.
That's right. Okay, I'm going to come back to you both if you don't mind, because obviously we've been talking a lot about in this country the reopening of the economy, the balancing act that has to happen in terms of public health restrictions and trying to get people back to work in some way, and all of that very closely tied to trying to avoid a spike in new cases. And we are seeing some of that in countries where it had seemed as though the pandemic was under some control, whether it be South Korea and even in Wuhan, where of course this all originated. Now its entire population being tested because there has been an outbreak of cases again in Wuhan. So I wanted to bring in someone who knows infinitely more about all this than I do, Dr. Suman Chakrabarti. He's an infectious disease specialist in Mississauga, Ontario. Good to see you again, Doctor.
Good to see you. Thanks for having me.
So I will say, especially when I heard Wuhan having this outbreak, and I don't know if that's just because it's the place where it seems to have originated from, the virus seems to have originated from, it was very worrying to me as we are sort of slowly moving in this country towards reopening. So how should we read what's happening in Wuhan or in South Korea or other places that are sort of further along in the life cycle of this virus than we are?
I agree with you. And, looking forward to what's happening there, we really want to take all those situations and use them to our advantage so we can learn more and accordingly respond. It's not surprising, though, that when you pull back on your restrictions, you're going to see more cases arise. And the point is you want to be able to identify those cases quickly, do the contact tracing, and isolate and put these small fires out so there's not going to be a big fire. That's the main goal going forward.
Right. And we've heard that certainly from our public health officials as well. But in the case of Wuhan, just to give people, in case they don't know, they plan to do testing of 11 million people, the population in that province, and say that it could be done within 10 days. I mean, that's just staggering. That's a staggering effort that they are throwing at this. But is it something we could replicate here? I mean, we are not at that kind of testing level, it would seem to me.
No, and there are certain things that countries can do that are different that we're not able to do here. So in China, they were able to do a lot of these types of things, mainly because the government has quite a bit of control over the population there.
That's right.
It's not the same here, but we can still do broad spectrum testing, do as much more testing, and really, really look at where all the cases are. And again, trying to early identify these and try to put out these small fires where we can.
What about contact tracing? There's been lots of questions around testing itself and whether it needs to expand beyond the criteria that we see right now, and it has done that over weeks of time. But if we move to a situation where we're not testing everyone, but we do want to be able to trace where they are, do you have in your mind a sense of how big that contact tracing team would need to be?
I can't give an exact number, but I agree with you. The general principle is we need to have a big team to do that. It's quite painstaking work, but it's very important. But you're right. We can't just be testing people, for example, who have symptoms. We have to broaden that definition. And we have to also go into certain targeted areas that we know are higher risk, like in the hospital or in a long-term care facility. In those situations, you may have to do repeated testing, even of people who don't have symptoms. It's very, very important with our response going forward.
In the case of South Korea, it appears to be one guy for now who was at a bar or a nightclub, and now they think it's spread to more than 100 cases, I think, linked to this one person, which is exactly what we're trying to control, right? The replication of the passage of the disease between multiple people. What does that tell you about the likelihood this country is ever going to get to a place where bars or nightclubs are open? Because to me, that I read that and say, okay, well, that's not happening until there's a vaccine. What is your assessment?
I agree with that completely. So South Korea obviously had a remarkable response. And one of the problems is with COVID-19 is we know that it spreads the best in an enclosed space with multiple people. And that's, of course, what a bar and a nightclub are, concerts, that type of thing. So I don't think that we're going to see anything like that for about 2 years. Minimum. I hope I'm wrong, because I really want to go and see Metallica again. But we need to do this in a careful way. But that's going to be the last phase, and likely, like you said, when the vaccine is available.
Yeah, there's a great article by Dave, I've lost his name now, in The Atlantic about when can I go for a concert again, and I'm sure other people can. Dave Grohl, yes, I'm sure other people can feel I'm sure other people can feel your pain. I appreciate that human moment there, Doctor. Thank you so much for letting us pick your brain a little bit today. I appreciate it.
Great, thank you very much.
Dr. Suman Chakrabarti, an infectious disease specialist and a Metallica fan, apparently, joining us from Mississauga, Ontario. Okay, I'll go bring in Vashi and David one more time to talk a little bit more about what we're talking about there, I think, and that is the issue of reopening. Maybe not a Metallica concert for everyone, but we do know that that balance there between making sure things are in place in order to loosen restrictions is very hard, and I'm not sure that we've seen that people are confident that those measures are in place yet when it comes to testing and contact tracing, Vashi.
And I think, Rosie, the South Korean example that you brought up is so interesting. I've been doing as much reading as I can into how they're contact tracing, how they're dealing with travelers, for example, because the restrictions not only have been loosened, but they were never really as clamped down as they are here. And what really jumps out at me is, for example, the level of contact tracing, the rigidity of the program, the apps that they have in use, or travelers who come in are automatically quarantined. Then they get an ankle bracelet. They're tested. Their temperature is like the measures are much more plentiful than they are here right now, and still they're dealing with now that outbreak. Certainly they have the ability to trace where it came from and people who may have come in contact with that person, but there are still a lot of questions about does that eventually slow down, for example, kids going back to school, that kind of thing. It feels like we're in the middle a bit of an experiment, right? We don't, to be blunt, we do not have the level of testing for any province to be completely confident that they can, totally lift all restrictions and reopen the economy. We just don't. That's a fact at this point. That capacity is ramping up. That's certainly true, and it depends on the province you're living in, and obviously the case numbers and the spread of the virus at this point. But I think it is sort of interesting to see the examples of other jurisdictions and how they deal with it. And what becomes so evident is even as you loosen those restrictions, it is so easy for something to happen in which you have to tighten them up again. And it does feel like we're going to be living on a bit of a seesaw for a while watching that.
Yeah, this is probably a good time to plug that little box that you're seeing on the bottom of the screen, and that's this virtual town hall we are doing tomorrow night on CBC and CBC News Network with my friend and colleague Duncan McHugh, and we are asking some of those kinds of questions and talking to people about how you live with the virus, because it's quite clear that we're not moving past it at this stage of the game yet. So the things that people are doing, adapting, whether it be your health, the things that you have to do personally, or even just your own finances, how you're going to manage all of that. So you can watch that tomorrow between 7 and 9. And there's a website if you have any questions. It's covid@cbc.ca. May as well plug something I'm doing myself. David, over to you on those issues, because as Vashi rightly says, because we don't have the testing and contact tracing at the scale where it really should be at, it does mean that the public health restrictions in some ways remain in place, even if you're allowed to do a little bit more. And that's why we continue to hear the Prime Minister saying, keep your distance, don't go out if you're sick, wash your hands. Those measures, those directives are not going to change, even if you're allowed to do a few more things. Yeah, I mean, it's almost impossible to contemplate the reality of the situation that we're in, right? I mean, all of the lockdowns and everything we're doing in terms of physical distancing and staying at home, that was all to stop the health system from being overwhelmed. Right? It was to keep the capacity in the intensive care beds and the critical care beds, and to stop an overloading of the health system, as we saw in places like Italy, for example, where it just got completely out of control. These measures aren't about a return to normal, and we have today the Prime Minister and yesterday announcing what are still
emergency support measures to help individuals and businesses cope with the lockdown. And we all want to look ahead to the return to normal and the reopening, and when does the border come back, and would schools reopen like they're doing in Quebec, and when can you go out to a bar to have a drink with your buddies. But you know, there are still borders inside the country that are closed off, right? New Brunswick doesn't want people to come to New Brunswick. I was supposed to go home to Newfoundland and Labrador for a wedding for one of my buddies this summer. I'm not allowed to enter the province now without permission because I'm not a resident there, and any kind of even going home to visit my family would not be considered essential travel. We're a long, long, long way from a return to normal. We're a long, long, long way from having the sort of daily testing capacity where we can do the test, trace, and isolate that worked so well in the early days in places like South Korea and have worked in places like Germany, but are not a 100% permanent solution to this problem. I mean, it's a vaccine or some sort of antiviral treatment or whatever we get to in herd immunity, but we still just do not know so much about this virus, and we just don't have the coping mechanisms yet to function well as a society. So, I mean, what we're doing right now is going to be what we're doing for quite a long time. And there's even the question of if governments did start reopening things and loosening restrictions, would people do it? There's still a doubt and a fear and things like, you know, here in Ontario, I've got school-age kids. If Stephen Lecce, the education minister, opens schools tomorrow, I don't think I'm sending my kid to school just because I'm not convinced as a dad it's the right thing to do. So I know there's a lot of impatience out there and a lot of frustration out there, but you can't rush science and you can't rush a public health emergency, and you don't solve the economic problem through economic measures. We solve the economic problem through public health measures. And trying to skip the public health measures is going to just compound everything and make it worse.
Yeah, and that's why it is so unprecedented, and the response is unprecedented, and there's so many things that we don't know. I'm going to come back to both of you if I can and turn our attention to a story that developed overnight. Canadian singer Bryan Adams facing accusations of racism over social media post about the COVID-19 crisis. The singer has now apologized, sort of, on his Instagram, but the original post continues to draw all kinds of attention and criticism, and the CBC's entertainment reporter Yelena Adzik is in Toronto with more on this. Maybe a weird thing for me to be talking about, Yelena, but it is something that the Prime Minister, ministers, public health officials have talked about, and that is people in a celebrity, positions, public high-profile positions, saying things that can contribute to racist attitudes and to derogatory comments.
Yeah, I mean, that's the concern here. Just to backtrack, before I share with you the apology that came out just recently, why don't we start, Rosie, with that original tweet? It was actually an Instagram. The tweet was deleted. The Instagram comment section were removed. What he did was he posted his song, him singing the hit that he had in the 80s, Cuts Like a Knife, and he shares what he feels is the blame, or where the blame should lay when it comes to the virus and his shows that were planned in London. So I'll give you a look at that statement, where the key points here that a lot of people are talking about is that in laying blame, he references phrases and words such as bat eating, wet market animal selling, virus making, greedy. It's laden with expletives. And he talks about the fact that it's not just that he's concerned about his show. He knows that more, thousands have suffered or died from this virus. And his message to them is he's saying, thanks a lot, of course, being incredibly sarcastic. And he just really caused a lot of people to comment, to start open a conversation about what is really right or fair for someone to say, because the wet markets that he's referring to, of course, we've been hearing a lot about when it comes to the World Health Organization, initially saying that there was probably some sort of a link between a wet market, which is just a market that sells live fish or animals, and poultry in Wuhan, in China. However, they have often reiterated the statement that there is no link that has been concretely proved. We do not know for sure. And so there have been a lot of people coming out and saying that these kinds of words, this sort of language, it leads to xenophobic talk that is linked to racism. I'll give you an example. Amy Go, who is the president of the Chinese Council for Social Justice, she said that these comments were racist. Also, you're looking at it, I'll put that back up actually. This was a tweet that was sent out by Simu Liu. He is a star of Asian descent on the show that many people know, Kim's Convenience. He says, it's not my intention to go at or cancel anyone, but to identify posts like this that condone and enable acts of hate and racism. It runs counter to everything I love about Canada. Then he says, I hope Brian does better for the millions who look up to him like I do. Bummer of 69 was a hashtag, of course, a play of words on Summer of 69. Now, Brian Adams apologized by saying that, listen, I apologize to all that took offense to my posting yesterday. No excuse. I just wanted to have a rant about the horrible animal cruelty in these wet markets being the possible source of the virus. So he's a little less definitive today, and he wanted to promote veganism. I have love for all people, and my thoughts are with everyone dealing with this pandemic around the world. Obviously, you know, going back a bit on his statements and certainly going back on the terse nature of his comments. And so this is someone, when you look at Brian Adams, he really isn't someone who is prone to this kind of strong language. I mean, he's got 15 Grammy nominations, 3 Academy Award nominations for various music he wrote for movies. And he's been lauded, as many know, for decades as this Canadian example of someone who plays around the world. He's also turned to photography and has taken photos of dignitaries and all kinds of prominent Canadian people. So yeah, as we started off, you were saying that he is a person of influence for sure. And so that has what, and when you look at the tweets that people have been sharing, they run the gamut from people who used to be fans who say they're so disappointed and they really felt like a racist hit against either Asians or Chinese people. And then the other people who are saying, listen, I agree with his animal rights points and don't want any animals to be eaten. And that is something that was shared from PETA. PETA, of course, being that organization for animal protection. They said that they reiterate some of his comments. They support what they're saying and that they really want people to stop together. So a lot of people sharing back and forth on this one, and it's going to continue because even though the apology is out, when you issue a statement that he did in the first place with such strong language, you know it's going to keep trending online.
Yeah, and never took the statement down, I would point out, even as he continued to complain that he wasn't allowed to play concerts. All right, Yelena Adzik, thank you for that difficult topic to talk about, but appreciate you bringing all of that to us because I know a lot of people were talking about it overnight, certainly, trying to figure out what it was all about, but more importantly, perhaps the message that we've heard from many politicians and public health officials, and that is that it's important for particularly people in public positions to not spark racism against Chinese and Asian Canadians or anyone around the world for the links that they might be suggesting there. Let's bring back Vashi and David for one last chat before we go. Let's go back to the seniors announcement today because people might just be tuning in and we've been trying to get more information about how quickly this will happen, how quickly it will roll out. Vashi, do you just want to remind people where the government landed on this? Because it was something we were asked about for many weeks.
Yeah, and the Prime Minister had signaled a few weeks ago that it was coming any day, and we were hearing from seniors very anxious to find out when that day is. The day is today. The federal government has announced that if you receive old age security, you'll get $300. If you get the guaranteed income supplement, you'll get an additional $200, and that's per person. So if there are 2 people in your household, you can get up to $500 each. It's going to be a one-time payment, and here's what's key. It's automatic. So you do not need to go onto the internet, onto an application portal and submit an application and say that you meet certain conditions or attest to anything. Because you are on OAS and or GIS, you will receive this benefit. The federal government estimates that it's about 7 million seniors who will qualify for this, and they estimate that the grand total of the program is $2.5 billion. I want to acknowledge that there are a lot of seniors who were asking or are asking if there are going to be additional supports, and the Prime Minister, as well as the Minister of Seniors, certainly didn't rule that out in the future, but with this benefit, they were looking to address, they said, sort of incremental extra costs. So things because of the pandemic that you have to pay extra for, the delivery of groceries, for example, dispensing fees for drugs, for pharmaceuticals, or taking taxis instead of public transportation. That's why this is $500 and it's happening once. There are other requests for the federal government, for example, to bring down the amount that retirement saving plans are taxed at. So tax it less or take away some of the taxes if you have to access that money. Again, the Minister for Seniors hasn't ruled that out, but she certainly did not provide any specific timeline for a decision on that. That has been one of the major asks from organizations which represent seniors.
Can I just get you as well to update us on the student aid? I thought we were going to talk to a student. Unfortunately, it didn't happen. But that is also not working yet. But just maybe bring people up to speed on that. Yeah.
So the latest I have on that, and remember, this is $1,250 in an emergency benefit, just like the CERB for students. And then also, if you have a dependent or a disability, it becomes $2,000. I believe it was originally $1,750. Now it's $2,000. So the Employment Minister, Carla Qualtrough, I asked on Friday, when does this application portal open up? She said at the latest, it will be this Friday. So we are looking at sometime at the end of this week. I just checked back with the government to see, are we still tracking for that? I haven't had a response, but I'll tweet it out whenever it happens. That is going to be different than the seniors one. You will have to go online. You will have to actually attest that you're working, fill out a couple other qualifiers, and that's how you're eventually going to get your money. Really quickly, apply for the My CRA account, just like with the CERB. That will ensure that the money goes into your account really quickly after you apply.
Yeah, so do that now if you're a student waiting, because we are a couple weeks into May, and I know some students are feeling the pinch here because they can't find jobs and they are looking for that aid benefit. David, I'm not sure where you want to go. What would you like to talk about?
Well, two things. The details of the boost to the OAS and the GIC, that shows the benefit of being able to use the existing program infrastructure that's in place, as opposed to creating something new like the CERB, where we've had the conversation in the virtual question period about the fraud that is potentially taking place there. This makes sure money goes to people who qualify and in a very targeted and direct way, and it's a lever you can pull over and over and over again, depending on the length of this, to get the money in there. The other thing we should expect details on this week is the extension of the wage subsidy that the Prime Minister announced last week. This is a program that is supposed to run until June. He said it will be extended beyond June, but there will be some new details about that, maybe some changes to how that would work, and because I mean the money is still in the getting money out the door phase on that program, but we are going to get details from the federal government on that at some point this week, because this just shows you, going back to our conversation about the duration of this, the need to extend some of these support programs beyond the initial plan and maybe deep into the recovery phase to allow the economy to extend and try to grow and come back and allow people to go back to work. It's a very tenuous situation for a lot of employees and employers right now. The extension of this is going to be a significant piece of public policy. More details to come in the next several days.
Yeah, and I think we're also expecting some more details on the commercial rent program, or for the commercial rent program to open up this week. Am I right, Vashi? I think I asked you this
anxiously. People are anxiously awaiting those details because we're 2 weeks out from the end of the last month that program's supposed to help with.
Yeah, so I mean, listen, we're well into all of this, and there's still new measures being announced and still measures being fixed that have been previously announced. So lots of response still from the government to come. Thank you both very much. I appreciate it. Vashi Kapellis, you can check out her show at 5 Eastern tonight. And David Cochran, thank you. We'll see you again tomorrow. So just to wrap things up again, the primary announcement today from the government really about seniors, something many of you had been anxiously awaiting. Again, as Vashi pointed out, if you're already receiving OAS or the GIS, you don't have to worry. The money will come. The government says as soon as possible. The Prime Minister says in the coming weeks you'll get that extra little top up to help you through this pandemic. All right, we'll end our coverage there for today here on CBC News Network. We'll of course be back here tomorrow for your regular federal briefings. Andrew Nickel will pick up our coverage after this. I'm Rosemary Barton. Thanks for watching us here on CBC News Network.